The main thrust of my argument today is as follows. You have to make a distinction between randomized controlled trials with verified outcomes and what I would call everything else, which you could say is whatever. Okay, these reviews of field studies, reviews of observations, reviews of this and that, if they're not randomized controlled trials, which is the only way to establish the effect of a medical intervention such as mask wearing, then it is of no value for what the medical profession considers. Okay, so this is very clear, and the history of this has some striking examples in it. For example, there were some of these whatever trials that were done to justify the use of antiarrhythmic agents to help people that have cardiac difficulties, and the observational trials were glowing, and these things were put on the market, and then randomized control trials were made. And guess what? The opposite was true. It actually gave you more problems and caused more mortality. This is a very recent example from the late 80s. Another example is hormone replacement therapy. All the studies were just so nice and positive until a randomized control trial was done, which found that instead of preventing heart attacks, they actually induced heart attacks, this hormone replacement therapy. You had to do the randomized control trials to find out what the truth was, because a randomized control trial is designed to remove bias. You know, the bias that Kyle is an expert on recognizing. That's the whole idea of a randomized control trial. And in the case of a mask, it's important that you add that there needs to be a verified outcome. That means you have to actually measure using a laboratory test whether or not the person was infected or not. Otherwise, you're just asking them to describe their illness and to give evidence over the phone or by a conversation, which is not acceptable because it's laden with bias. So those are the only kinds of trials that have a hope. They're not perfect, but they have a hope of getting an answer as to whether or not a mask can help you compared to not wearing a mask, for example. Randomized controlled trials with verified outcomes. Now, what did I say in my paper? Let me remind Kyle what I actually said in my paper. If we go to page 4 of my paper, there's a section entitled Conclusion Regarding that Masks Do Not Work. And the very first paragraph says, no randomized controlled study with verified outcomes shows a benefit for healthcare workers or community members in households to wearing a mask or respirator, meaning an N95. There is no such study. There are no exceptions. There have been many studies, and I'm going to tell you about them, but none of them have found a statistical significant advantage.